One Nation says it would force new Australian-trained GPs to work in regional or remote areas before they could access Medicare's bulk billing incentives. While a similar program already exists for doctors trained overseas, Barnaby Joyce says Aussie GPs should have to spend up to 10 years doing regional service before moving to a metro area where they can bulk bill. Let's bring in Barnaby Joyce and Social Services Minister Tanya Plibersek. Morning to both of you. Barnaby,
good morning.
We'll start with you. You say there is an abundance of doctors in the cities. Talk us through your plan.
Well, first, I would say that obviously the major parties are very concerned. So you're going to get a range of hit jobs, ladies and gentlemen, on One Nation as they try to work out how they can deal with our detail when they have none. In regional areas, some regional areas, we don't even have a doctor in a hospital, a full-time doctor. You just don't have it. You have a hospital, but no doctor. And we've been waiting years and years and years for the AMA and the major parties to come up with a policy to get medical services into regional areas. You've got areas they've certainly got women, but they've got no obstetrics. So a big problem if someone wants to have a baby. And that's remote towns as remote as like Muswellbrook, so not very remote at all. They just closed down the obstetrics wards. So there has to be an obligation that if you go to, that you spend some time, like other countries, in regional areas so that all Australians get an appropriate medical service, a basic medical service. Because all we have at the moment now is locums, and they come in and cost you about $3,500 a day in some areas. Now that is unviable. So a period of time, if you go to a very remote area, it's not a long period. If you go to somewhere like Newcastle, well, yeah, it's going to be longer, but there's got to be a form of quid pro quo back to the Australian people for the investment in those doctors, because if we don't, we just go along with the problem and we wait for magic to fix everything. And One Nation's not waiting for magic to fix the issue of regional health. We have to do something vastly more pronounced. And if anybody else has got a policy to get doctors into regional areas that works, let's hear it.
Tanya, nearly more than a third of the country, 10 million people live in regional centres.
Yeah.
What do you think of this proposal?
Well, we completely agree that we want to see more doctors in regional areas, and that's why we've increased the incentives for doctors to go there. And it's why we're investing $816 million in training new GPs. 2,100 new offers will be made to train GPs this year, taxpayer funded. Half of those training places will be in regional areas. So just one example, in Launceston there will be 20 new GP training places, and we know that if someone trains somewhere like Launceston rather than Sydney or Melbourne, they're much more likely to stay in Launceston or northern Tasmania. Now, this is something that Barnaby Joyce could have done when he was in government. He chose not to do it. We're cleaning up the mess once again. It takes a few years to train a GP, but we've started on that with an $816 million investment. But that's not all we're doing in the health system for regional communities. In Barnaby's electorate, in Tamworth, there's an urgent care clinic that's seen about 27,500 people, about 221 on average every week since it opened. 365 days a year. Because we've increased the bulk billing incentive, we've seen 1,300 extra clinics now bulk billing around the country. An extra third of clinics are now bulk billing. And Australians have saved more than $2 billion on the cost of their medicines. So urgent care clinics, cheaper medicines, more training GPs, more training of GPs in regional areas so that they when they train there, they stay there. We know that.
Okay,
Right.
Barnaby, you want to say something?
Yes, there you hear it, ladies and gentlemen. The regional health crisis is fixed. See, Tanya's just told you there is no problem. And that's the problem we have. Complete blindness to the problem. We don't have doctors in a lot of regional areas. And we don't want fly-in, fly-out doctors. We want a GP who lives in the areas. You have an urgent care clinic. Yes, you do. But that is like a doctor supermarket. You walk in, next time you get a different doctor, next time you get a different doctor. If you have endometriosis, if you are having a child, if you have a chronic illness, you want to see the same doctor, at least for a short period of time.
Barnaby,
but we don't.
We've got 33 endometriosis clinics that never existed when you were in government.
You're the government. We always get back to this, ladies and gentlemen. Tanya is part of the government.
Yeah, it takes a few years to train a GP,
Okay, Tanya,
and you should have started more.
At the next election.
Tanya, how many more doctors have you got in regional areas? Let's take the clinics out. How many more doctors have you got in regional areas? Permanent doctors, would you know since you came to government?
The health minister would know exactly how many, and you can get him on to talk about this. But we're training more, and it takes years to train a doctor. And Barnaby Joyce could have started this at any time. And he just mentioned endometriosis.
Government doctor.
Barnaby, he just mentioned endometriosis. Yes. We've got 33 endometriosis and pelvic pain clinics that never existed under
regional areas,
Liberals
in
and
regional
Nationals.
Areas, Tanya?
Yes.
Have you got them in regional areas?
I can't list all 33 of them.
Well,
yes. I can't.
So
I can't list all of them off the top of my head. Why don't you talk to the health minister?
Is there any? I don't know whether it still exists, but you used to.
I'll put it on my socials after this.
Good idea.
Good.
Yeah.
So Tanya, there used to be a system where if you were a young school teacher and you went to a remote area, you then did a few years and you got a better school in the city if you wanted one. So is there anything wrong with the concept of sending young doctors out to the bush for a few years? Do you object to that?
Well, I think training them in the bush is the best way to do it, Nat, because
but making
then you
them
get
go there,
kids from regional high schools. But why should
they go from the?
We want to incentivise people to go there. We want to give them more money. We want to give them more money and more opportunities when they're in the bush. But Nat, the best way to get a doctor to stay in a regional community, to be the GP for that regional community.
I think I'll know a little bit more about this.
Hang on, Barnaby, can we just let Tanya finish? Yes. The best way to get them to stay in a regional area
is to train up young people from those regional communities to do medical degrees in the regional universities. They live there, they grew up there, they've got family connection, they study there, they get a great education, they get a great job. That's exactly what we're doing with an $816 million investment that Barnaby Joyce could have made at any time but never did.
I have a good example of this.
Okay, one last thing, Barnaby. Yeah.
My daughter went to one of the regional medical facilities, She graduated as a doctor, and guess where she now works? Brisbane.
Did you suggest that she stay in the bush?
Yes.
What'd she say?
She says she gets a better lifestyle and more money if she goes to the city.
So you've got to force them out there.
Just like school teachers, just like other countries, not force, but there has to be an advantage if you spend a period of time in regional areas, a period of time at the start of your careers. Because I tell you how you get doctors to stay in regional areas. You get them to practice for a period of time in regional areas. That's how you get doctors to stay in regional areas.
Yeah, and that's why we're setting up regional medical schools. That's why people are doing their training in regional areas, Barnaby. All things that we have done, that you could have done and didn't.
Let's do Sunrise from Walgett. Let's do Sunrise from Muswellbrook. I'll show you how it's not
Tanya,
working.
you're saying you're setting them up. Barnaby, you're saying you have to force them out there. I think that sounds like it's...
Yeah, he's saying you have to punish them. He's saying that you have to punish people if you want them to live in the bush.
Area? What was the punishment growing up in Bunbury?
They have no doctor.
Okay.
Your solution is no doctor, Tanya. That's what
I think we've got both sides there, so we'll leave it there because we've got to go to the news. But thank you very much. We'll see you next week. Here's Sherbo.